Okay, so we're back to our hair health check once again. So we know we've looked at the hair cycle. I can't stress how important it is to check the hair cycle. We know that Colette's concern was more around her hairline, but you've always got to check to see what's happening with the hair cycle. In her case, it's all good, which is fantastic. So the focus will be on female pattern thinning. So female pattern thinning is caused by DHT Dihydrotestosterone. We all have it. Everybody has DHT. It just gets triggered to do something it's not supposed to do. It's actually responsible for your body hair, by the way. It's part of your integumentary system, and it keeps the homeostasis in our body. Anatomy and physiology is fascinating, and it teaches you all about that sort of stuff. But for this purpose, the DHT does something it's not meant to do. It starts to bind to the hair rather than growing the hair. And this gets triggered by hereditary, hormonal and environmental factors, as I mentioned before. So what we're seeing these days is even if it's not hereditary, it's coming in very young people because we have a lot of hormonal and environmental factors that are triggering this to happen. A lot of it is excess estrogen and different things as well. And we had a conversation about some of the concerns you're having with all the exercise and the good eating that you do, and nothing's really changing for your muscle mass because you're trying to build muscle. Well, that can say sometimes that there's excess estrogen. A lot of the time there's the pill involved. It's the birth control pill, but sometimes it's being used for acne, which we discussed as well. And there's different medications that are being used for your oil glands associated with acne as well, and that's all over the world. And it does affect things. It really, really does. So we're finding this female pattern thinning, male pattern thinning as well, is happening at a much younger age. What we need to focus on is the DHT. The DHT needs to stay in your body, but we have to stop the binding and then also look at where, if the estrogen is coming from hormonal and environmentally, we need to address that and slow it down. But it's best to do it naturally, because a lot of the time the reason that it got there was synthetically anyway. So here at Absolique, we're a natural therapy clinic because a lot of the other things cause side effects which affect the body, trigger this, and can actually cause hair loss. So the first thing that I would teach you to do is wash your hair. Yeah. The reason being is we have a natural product which is an antioxidant that we can spray onto the scalp, and that can absorb through down, and it can protect it because the DHT is acting a little bit like a free radical. And you're telling me about the oil problem, that it's always oily around the hairline and you can't, your fringe won't do what you want. If we can clean that scalp and get the oil glands all clean, wash it away with a safe scalp cleanser. And this is important as well. A lot of these things are coming from our cosmetic products. Okay, you've got sodium lauryl sulfates, parabens, propylene glycol. It's all in our shampoos and most of your cosmetic products. So when we're treating this stuff, we need to remove anything potentially can be a cause. So we'll recommend a safe scalp cleanser. It's not specifically organic because I find a lot of the organic products are for the hair. They're more softening, but they don't clean the scalp skin. And what we really need to do here is get that oil out. But it's got to be pH balanced as well. So I can't strip it off. So no coal tars or anything like that either. So it's a nice formula that actually cleans the skin. It makes it feel different. And you'll find that the oil doesn't come back so quick. So you're washing how often now?
About 3 times a week.
3 times a week? I think that's probably pretty good. You know, 4th is probably when you do a bit of exercise and a bit more oil there, so we'll probably say 3 times a week is more than enough. Each time we do it, we do brush therapy, scalp cleansing. You do as many scalp cleansers as you can until it foams up, because it's got no foaming agents. So if it doesn't foam, you need to do more to make it clean. So generally the first time you ever use one, it's 3 to 4 times, and then after that it might be average 2. Never 1. One's like rinsing the dishes, and then you've got to wash the dishes. So it's always twice. And it's all about cleaning the scalp environment so we can use this natural spray. The natural spray has no chemicals. So if you don't clean and prepare the scalp first and you spray it on that, it simply won't work. So there's a method to the madness of natural therapy as well. That's the simple approach. If you really want to go in and address it, you need to block the DHT, and we use nutritional products for that. That can be quite complex because then you're relying on digestion and absorption. So the main ingredient that is used these days for blocking the DHT is saw Palmetto. So a lot of people have checked that out online. I like to use it in a combination. So I have a formula that we use for women and a formula that we use for men, which are different strengths and different combinations. That has to be in a pH alkaline environment, otherwise it won't work. So that's why we teach pH testing and alkalizing as well. The next step to that is moving the DHT away. So we'll stop there and we'll come back and talk a little bit more about how you can move the DHT away.